I'd like to now invite Dr. Jonathan Irish, Provincial Head of Surgical Oncology at Cancer Care Ontario, a great collaborator in the Techna Institute, heading up our medical faculty, to introduce the debate. Dr. Irish.
Thanks, David. And if I can have our two debaters come up to the front, please. Feel a bit like a split personality. Yesterday, I took care of 25 patients in the clinic, and as a cancer surgeon, I really wonder how much I contributed to value-based care. I'm very lucky. I actually have an iPad I carry with me that's connected to our informatics system, to our EPR. I can get data as I go. Not everyone can get this. It was created by Techna. And I can enter outcomes on behalf of the patient. I can enter survival. But, quite frankly, I got really busy during the clinic. It was me and my fellow, my resident, and he got called off to do an emergency tracheotomy, and I was there alone. And I can tell you, the value-based data entry clerk got busy, and honestly, taking care of patients got the best of me. And so that's where value-based entry ended. And how do we make it incorporated into everything we do? So my patients had dysphagia. There were various stages of their recovery and treatment, alive with disease or dying. They had various aspects of what they were living with, what quality of life aspects, dysphagia, difficulty swallowing, pain, and so on. So that concept that Frederica mentioned this morning of value-based care and outcomes is so critical to make our decisions. Then I put on a hat as the provincial head of cancer surgery for Cancer Care Ontario, overseeing the care for 13.8 million people in this province every year, 70,000 operations, cancer operations, which I fund and oversee. My group oversees that. The quality-based procedure funding formula associated with that. 50 feet from here, actually in a room, are the top 50 liver and pancreas surgeons in the province sitting in a room creating the quality metrics for next year's QBP in liver cancer surgery. And they'll use data, length of stay, readmission, reoperation, infection rate. But where is quality? Where is, for example, patient outcomes? How the patient feels? Where's 2-year, 5-year, 10-year survival? In other words, where is the funding throughout the life of that patient? So we have a ways to go. Even in our most advanced centers, we have a ways to go. So it's a good segue to this debate here today. A debate between two learned colleagues. And do I have my slides? Yes. And so the debate proposition is medtech companies will stay in Ontario if outcomes-based care is adopted. And there are rules, ground rules, like every debate. Arun Manawat, the CEO of Profound Medical Incorporated, and previously from Novadak Technologies, and that's where we first met. A pioneer in the implementation of fluorescence and fluorescent-guided surgery in the operating room, PhD in chemical engineering from the University of Maryland, MBA from Northwestern. Welcome.
Thank you.
Hold on for a second. And then we have Lahav Gil, founder and former CEO of Kangaroo Group, deep experience in med tech development and business, having co-founded 6 companies at least, both here in Canada and Israel, a profound expert in technology and implementation. And these combatants will debate a formal discussion on a particular topic in a public meeting or legislative assembly, unfortunately not, in which opposing arguments are put forward. There is a vote, and I'm going to ask you to vote shortly. We'll have a pre-debate vote and a post-debate vote. And these individuals will be judged on this. So how are we doing how are we doing the actual vote? Yeah? So all in favor of the 4? Yes or no? Perfect. So about 83% or 85%, let's say, in favor. I'm going to ask for Lahav Gil to kick it off with the 4, already in the lead. You have nothing to lose, really. The debate will be.
Actually, I'm taking the no.
Of course you are, and that should just of course. So when I had my pre-debate telephone conversation with these, one of them said, "Some things I will say I actually do not believe." So you can see what I'm starting with. So I'm going to ask Lahav to go first. I actually don't know which side he's actually in favor of now.
Okay.
He has 12 minutes.
So Lahav,
and
I just want
followed
to make
by
sure you don't offer free drinks to anybody here.
followed by
Not planning to.
followed by Arun, who will have 12 minutes, followed by a rebuttal of 5 minutes each, and then we'll have another vote. Go ahead, Lahav.
Okay, so I'll just
Tell me which side you're on.
Yeah, just to clarify, I made the choice to represent the idea that companies will leave Canada in spite of, even if we move into a value-based, into a value-based healthcare or healthcare procurement system. So that is my position. That's the position that I'll try to represent as much as possible. I'll just stay sitting
Right there?
Actually, I can come. I can come.
Yep.
That's
You've got 12 minutes.
okay. So thanks for inviting me, and we'll see how it goes. We'll see if I can represent that idea. Okay, so I've got the slide. So I should just say in the 12 minutes I have very little to say. I think I have the easy argument actually. I'll save you the suspense. I'm arguing, or I'm putting forward the idea that it doesn't really matter. The economy here is, the markets here are so small that it's not going to make an effect. But I'll do this. So this is the bottom line, but I'll just do it step by step. So first I should say that in my view, there's technology-based companies in medtech or in health technologies. Evidence-based companies have two very different stages in their life. One is before they get to the market, where they have to basically prepare themselves for the market. And the other stage, very, very different, is a stage where they operate in the market. And you could almost say that these are two different companies. Actually, you should say that these are two different companies, even though they rotate around the same core technology. I come from the culture and from the practice of preparing companies to the market. That's what I do. I build that capacity, and I have very, very little hands-on experience in operating or growing companies in the market, experience that Arun has. However, I've had the great fortune of working very closely alongside leadership and inside companies such as Ultrasonics Medical from the 2000s in Vancouver, companies such as FIO Devices, Celigis Devices, Exact Imaging, and a few, and Imris, of course. And I've worked very closely with those companies, and I've seen them develop. I've contributed in some way to their development, and I've seen how they move in later stages, how they basically need to move out of their, let's just call it, place of origin. And then I've also followed companies like Novadac, like Sentinel, other companies that I've seen from a distance doing their journey. So I guess my perspective is that these are two different companies as they evolve, and I'm more familiar with the front end. I'd say that the first thing that I'd like to say is this idea of why do we even assume? So where does the assumption come from that value-based procurement or value-based billing or value-based healthcare system has any effect on anything? So that's just to lay it out there. The evidence is not there yet, and the intuition, like I'm trying really hard to buy into these business efficiencies in healthcare, and I'm not sure I'm actually buying into it. I've heard a lot of fantastic presentations today, and one of the ones that I actually feel most akin to is just the presentation that was done a few minutes ago, and especially to this point of we're focused on disease. We're so focused on disease. I would even say the money is almost willing us to get sick, and then we'll make money on curing us. So that doesn't sound right to me. It never sounded right to me. And I think we've become we've created institutions and science and data about disease and fixing disease, and we're not so great, it's not balanced, we're not so great at creating institutions and science and understanding of health, wellness. I'm not even saying not getting to disease, just health and wellness. I would even say that if somebody professes some new idea about health and wellness, they are marginalized into the food supplement industry. So I find, and I'm a medtech innovator and entrepreneur. I've been in medtech for 15, 20 years. And I've also fallen into the same trap. I kind of innovate along acute, wherever I see an acute problem and an unmet business need, my mind starts innovating. And I'm not drawn, I wasn't educated to incentivize, to paradigmize, to innovate along the lines of health and wellness, and building health and wellness in individuals and in populations. A friend of mine, have I got time still? I'm just on my, okay, I'm just on my first. I have a friend who does system type thinking for health, and he just mentioned to me the other day that worldwide we spend so much money treating young, healthy, productive people as they come into the emergency room from accidents. Right? We're very good at treating broken bones and internal injuries, billions and billions of dollars. I do not have the data. But relative to that, the spend on preventing these people from being so messed up is relative to that very little. And I think that, to me, that's a metaphor for the way the entire industry works. We are actually spending, and I kind of want to say I blame capitalism for it. I should have said it at the beginning. I'm a fierce skeptic about capitalism. I'm not saying I'm saying no to it. I'm just a little bit, not a little bit, a fierce skeptic of the capitalistic process. So I'm assuming that we think that this value-based billing or value-based procurement will create some kind of a huge market or a fast adoption curve in Canada. Otherwise, I don't see the relation between this and adopting a technology. And I'll remind you also that a technology actually figuring out if a specific technology creates value in a chain of treatment is way more complicated than dealing with providers providing a general kind of healthcare. Like, how do you know if a tongue depressor actually performed well, you know, in a process of in a chain of providing healthcare at your family doctors? I know Medtronic is pioneering this. They're creating. This is where companies, very, very large companies who have the clout and the forbearance, the financial forbearance to actually step ahead of government. They're trying to create various ways to measure specific segmented technology type inputs into the outcome chain. But this is, I don't know. I don't even know if I'd like technology to be assessed like that. I'm not even sure that I've bought into the concept. Okay, so this gives you my bias. But I'm assuming that the question is the question that we're asking, and the one I'm saying basically no to, assumes that the market will become larger or faster in adoption. And I think this is where I need to pass this next slide. So I think that very simply, evidence-based companies, they start at their clinical origin and they end up at their market destination. They basically end up wherever there's a place to sell, and to sell at volume and to sell at speed. And I think that with or without value-based procurement, the Canadian market is basically going to be very, very small compared to any adjacent market. So I don't see that we're going to be impacting that, even if we make big decisions on that. And the next argument is that I think companies will eventually have to pick up and leave, and I think smart companies should be designed for that. I think smart companies should be designed. Just need some water. Think of a nomadic camp. You're designing your campsite so that you can easily pick up and leave based on an opportunistic event or a difficult event. And I think companies should be designed that way. Otherwise, they do have a difficulty to scale. And I think, so that's kind of the argument. And I think, and this is where I'm going to just hijack the conversation to something else, just frame it a little bit differently, because I have another 2 minutes.
Yep.
I have 2 minutes and 48 seconds, so I'm going to hijack the conversation twice. The hijack basically says that countries should not develop egos, they should develop strategies instead. And I believe that Canadians should, as Canadians, we should figure out what we're about and what are the strengths of what we have here as Canadians, geographical, knowledge-based, education, cultural, whatever the strengths are, and we should develop strategies around that. Those strategies, mind you, shouldn't always be leadership and jobs. So leadership is not a strategy, it's just something that we just say. Not everybody has to be a leader, and not every country has to be a leader in everything. So that's, or not every country has to continuously create jobs as there's the question of what type of jobs. Why? So strategies rather than ego. That's one hijack. The second, I have another one, is, which is, I thought I was like really unique in my thinking, but I guess I'm just part of the pack. We should focus on health as much as we're focusing on trauma and on fixing trauma. And in the last, so I'll finish early, but basically I'm saying that it doesn't really matter. Companies will eventually have to leave the Canadian ecosystem and move to where their markets tell them to go. That's it. Thank you.